Hey everyone, this is Bill Fricks, your physician group CMIO, and I'm going to show you how we are going to offer remote virtual visits to our patients. We have been making similar videos and help sheets for schedulers and most importantly patients so that as we kick this off, we'll hopefully have as few hiccups as possible. The good news is that your workflow and your electronic medical record will remain unchanged. You will still look for patients on your schedule, still document like normal, and place orders, submit billing, all in your familiar EHR. The only change you will see is that some patients on your schedule are identified as telehealth visits. Different EHRs will show this differently, but I'm just going to show you two examples of how this would show up in your ambulatory EHR Athena if that's what you're using. Here's one example of a schedule in Athena. All we've done is add an appointment type and add a note for telehealth. Here it stands out from the normal schedule. Some people look at a different view. Here's the different view, and the appointment type starts with a TH. So we've just added a new appointment type and a note indicating this is a telehealth visit. That's it. This identifier, whatever it may be in your EHR, is the signal to your check-in staff and nurse to call the patient by phone about 30 minutes prior to the appointment for triage and check-in. Their process doesn't change much except they are talking with the patient on the phone rather than in person. When it is time for your telehealth appointment, you will find a matching appointment in your Phoebe calendar. Okay, so if you have a 9 o'clock appointment with someone in your EHR, you open up your Phoebe calendar and you'll find a 9 o'clock appointment for that same patient in your Phoebe calendar with a link. Okay, that link will connect you with your patient. Just click the link, and as long as you're logged in to the GoToMeeting app, the one you'll need to download, you'll join your patient in the meeting room. If you already have a method for accessing your work calendar, that's great. Any calendar app works as long as it is connected with your Phoebe email. But if you want a tip, this is what I like to do. If you open a web browser, you can go to www.phoebeputney.net, not .com, .net, and it'll open up this page. You can sign in with your normal Phoebe username and password and your Phoebe email. If you come down here to your calendar, I have an appointment scheduled with Abby Test. That's her birth date. It's at 9 o'clock. I'm going to click this. I have a link, and I'm going to click the link. Okay, and that starts the connection process. I recommend you practice logging into the appointment prior to your first time, just so it's familiar to you. Even better, set up a meeting with a partner using the app and have a mock meeting to get familiar with the controls. If you want to click one of these links prior to the appointment, you're not going to hurt anything. So we've already started this meeting or this appointment. I'm on a laptop, and so I'm going to show you what that looks like. So as you log in, you'll see a couple of choices here. You can join on the web, and I would not do that. Don't use your web browser for this. The cameras don't work well, and if you haven't already downloaded the app, it'll offer you a link to download the app. But if you have the app already, it'll have this pop-up that says Open GoToOpener. And so I'm going to go ahead and click that. And now I'm in the appointment. There are two main buttons that are important in the GoToMeeting app. The microphone, which is red here, and the camera button. Both of these need to be green in order for your patient to see and hear you. Okay, so I'm going to click the microphone button. Now it's green. And I'm going to click the camera button. And now it's green. And there I am. If this is the first time that you have logged into the GoToMeeting app, you'll probably be asked some questions like, can the GoToMeeting app have access to your microphone and camera? Please be sure to give access, otherwise this won't work. Some other things to look at from the desktop view. You can see how many people are on the meeting right now. I've got 1. When your patient joins, it'll show 2. I'm going to go ahead and log in as a patient also, so you can see what it looks like when the patient joins. I'm going to mute my microphone. So now we're waiting on the patient, and they're actually on now. You can see, and by the way, I muted my microphone so I wouldn't get feedback. You can see that there's 2 attendees now, but you can't hear or see your patient. So sometimes there's a little delay as they're figuring out the controls. You can talk to them and tell them there should be a big red microphone button that they can click, and that'll help you. If they click it, it'll turn green. That'll help you hear them. I'm going to go ahead and there's a white camera button on their phone, just like there was up here. And if they click that and click share my webcam, there you go. Now they're on. And so there'll be a dual screen that you can talk to them. That's the desktop version. When you're done, you can simply click this red button right there, this close button. It'll ask you if you want to end the meeting for everyone. You can click OK. That's it. And you document just like you normally would in your EHR. Now I'd like to show you the iPad version. Here I have my iPad calendar pulled up. I'm going to go ahead and click the link in this appointment. So this is the iPad version. Looks a little different. You've got all this stuff in the middle. Your buttons are up here on the right hand corner. The microphone button, the camera button, and this computer screen button. What I'd like for you to do is click that computer screen button, and it's going to bring up this, and I want you to disable the present content. That's going to give you a more normal view, one that is going to look similar to the iPhones and what you're used to. I'm going to share my camera, and when you click the camera button, it comes to this screen. Some people will think that they're sharing their screen now, but they're not. They still have to take this second step. Click the share my webcam button here. Whoa. Now I'm on, and I'm going to have a patient log in now. So waiting on the patient. If you click the little people icon up here, if you click that, it'll show who's logged on. It's waiting for the name of the person logging on. There, oh, it's me. Now I'm going to share my webcam. There we go. That's pretty much it for the iPad. The microphone button, the camera button. Make sure you disable the presenting toggle under the computer screen button. And then when you're done, just click this little door up here on the top left-hand corner to exit the meeting room. Now I'd like to show you what this looks like from a smartphone point of view. I have an iPhone, but it looks similar on a Android or other device, I've gone into my calendar and I already have clicked on the appointment. Now I find my link. I'm going to click the link, and there we are. We are waiting for our patient. You can see by the little people icon up in the far right corner that I am the only one on right now. There's just one person. Again, your buttons, you have the microphone button and the camera button. If you tap the microphone, both will need to be green to talk to your patient and for the patient to be able to see you. I'm going to tap the microphone button. There we go. I'm going to tap the camera button, and again you get that little view where you need to share your webcam. Right now I'm not sharing it yet, it's just asking me to. So I'm going to click share my webcam. There we go. And now I'm going to have the patient log in. And you should see that the people icon has turned to 2. That way you know that there's somebody else on the line now. And you may not be able to see them yet or hear them yet. They have to click the microphone and camera for that to happen, so you may have to talk them through it. I'm going to go ahead and show you what it's going to look like. There you go. To hang up, you press this little red button down in the far right corner, the little phone, and that's it. So just to summarize, there's nothing different in the check-in and triage process except that they are doing it by telephone. Nothing different to do in your EHR. Just use it like normal. The only difference is that the patient won't be in front of you and you'll need to click the link in your Phoebe calendar to see and hear them. The app that I've talked about, the GoToMeeting, you've already received an account. You should have received an email from Ross Youngdale to set up your password. The email accompanying this video should have some more information if you haven't seen that email from Ross Youngdale. Some tips: the app will open without you logging in. You do need to click a button like My Meetings to log in. Any of the buttons, otherwise the connection won't work with your patients. So sometimes you'll think you're logged in and you're actually not. You'll find out when you go to connect with the patient, it'll put you in a waiting room saying waiting for the organizer. That's a key that, hey, I haven't logged in yet. So just back out and make sure you log in. Make sure you have a designated private space. A patient room works great to connect with your patient without distractions. When logging on, choose to use your computer audio and not the phone unless that's absolutely necessary. And don't use the web version, just use the app. The web version has problems with the camera on a lot of browsers. So if you have any questions, please don't hesitate to call or email. Good luck. Thanks, everyone.